Thank you, Jeff. Good morning, everyone, and thank you all for being here today. My name is Yousif Salim, and today I will be presenting my practical project on barrier and facilitator to implementing community-based hepatitis C point of care testing in Canada using the RE-AIM framework. Before going further, I would like to begin in a good way by respectfully acknowledging that I'm presenting from Territory 1 territory, traditional land of Anishinaabe, Cree, Oji-Cree, Dakota, and Dean people, and the homeland of the Red River Métis Nation. I had a great opportunity to complete my practicum at GC Wilt Infectious Disease Research Center in Nunavut, Manitoba, which is part of the National Microbiology Lab within Public Health Agency of Canada. As you can see in the figure on this slide, which highlights the center mission, vision, and mandate, the center serves as a key national hub for infectious disease preparedness, bringing together diagnostic testing, applied research, laboratory innovations, support public health responses across Canada. Coming from a medical background, what stood out to me was closely how lab science is integrated with public health program and how innovative approach can improve access to care and support hepatitis C elimination. I was supervised by Dr. Brian Head and worked with an incredible multidisciplinary team in STBI division. Let us have a quick context of hepatitis C. Hepatitis C is the liver infection caused by hepatitis C virus. It is classified as sexually transmitted disease or blood-borne infection, as it can be transmitted through blood or sexual contact. If left untreated, can lead to serious complications such as cirrhosis or liver cancer. In Canada, the burden remains significant with over 8,000 new infections, nearly 1,000 deaths in 2021, and an estimated of over 200,000 people living with hepatitis C. As you can see from this slide, the burden is not evenly distributed. It disproportionately affects people who inject drugs, indigenous people, and many individuals remain undiagnosed. About 2 in 5 people are unaware they are living with the infection. The good news is that we now have the tools. We have highly effective treatment for hepatitis C with cure rate above 95%. However, too many people living with hepatitis C remain undiagnosed, which means that they are not benefiting from this treatment. Additionally, the COVID-19 disrupted service delivery for hepatitis C and further widening these gaps. As a result, the burden continue to affect key population. In response, Canada's approach is guided by the pan-Canadian STBI framework and action plans, along with the community-based programs to reduce the impact of viral hepatitis by 2030. So the question becomes, how do we better reach the people who are still being missed? To walk you through this simple but important question, one approach is to bring testing closer to the people. This is where point of care testing comes in. Before I go further, I want to briefly introduce what we mean by point of care testing. Since it is central to this work, it means testing done at or near the site of the patient care rather than in a centralized lab. The National Microbiology Lab supports hepatitis C elimination through community-based point of care testing aligned with STBI action plan. On the slide, as you can see, on the left shows an example of rapid test for initial screening, and the second shows an example of a molecular platform, the GeneXpert system, which is used to confirm active infection. Together, they support test and treat approach in one visit. This helps reach people who may not access traditional care and reduce stigma and loss to follow-up. But testing isn't enough. Alone isn't enough. It is also about who we are reaching. This is where the idea of microemulation comes in. Instead of targeting the whole population at once, the focus shifts to the most affected groups, such as people who inject drugs, indigenous people, and those in remote areas. This makes approach more practical, more focused, and easier to measure. In addition, community-based hepatitis point of care testing, hepatitis C testing supports this concept by bringing testing out of traditional setting and into the community. Overall, this approach makes service more accessible, culturally safe, and community-led. Before diving into the analysis, I want to briefly introduce the team behind this work. This project is part of the innovative diagnostic program within STBI division as a national microbiology lab, which supports community-based point of care testing for several STBBIs, including hepatitis C, to improve access to diagnosis and care. As part of my practice, I also had the opportunity to work hands-on on different STBBIs, point of care testing devices, including supporting their verification before deployment to the site. For this project, the goal was to understand how community-based hepatitis testing is being implemented in practice. To do that, I used the REAIM framework, looking at reach, effectiveness, adoption, implementation, and maintenance. This allowed me to assess not just outcome, but how the program is functioning across different stages. I analyzed de-identified hepatitis C program data across these domains to identify where things are working well and where gaps exist. And to add a perspective, I also compared Canada's approach to the Australian model. Overall, the goal was to understand real-world implementation and help inform more practical and sustainable scale-up. So, what the data actually shows, this graph highlight a few findings. The first graph shows the implementation cascade. We see a drop from initial engagement to fully functional sites, showing where implementation becomes challenging. Second graph shows the testing distribution, gives a sense of overall reach and scale. The third graph shows urban versus rural distribution, emphasizing that most sites are concentrated in urban areas to date, with limited presence in rural and remote settings. The final graph shows distribution by setting, where most sites are community health clinic and indigenous sites with very limited representation in harm reduction services. Looking across 3M domains, the same overall findings are reflected, but distributed across different dimensions of implementation. Effectiveness is strong, with sites achieving high testing quality and full proficiency once they are enrolled in external quality assurance program, but getting site to that stage is a challenge. Adoption has also increased over time, showing growing system uptake. At the implementation stage, the key challenge remains the transition from trained site to fully functional site, despite the strong initial capacity building. Overall, the data shows strong quality and sustained engagement, but ongoing gaps in scaling implementation to full functionality. Bringing this together, the main message is about where the gaps are. Even with strong testing quality and early uptake, there are clear challenges in sustaining and scaling delivery. The challenges are especially visible in who is being reached with a limited presence in some key settings. This shows the need for more targeted strategies that support sites beyond the initial setup. To better understand this, I compare it to Australian point of care test implementation model. Australia faces similar challenges, including large geography, remote communities, and logistic barriers to diagnosis testing, like shipping constraints. However, it has established a mature system-level point-of-care testing model. This comparison enables the identification of key enablers and gaps to help inform optimization of the Canadian approach. They have a broader reach, including rural and remote areas, and a strong focus on community-led delivery. The implementation is more stable, supported by academic partnership and ongoing evaluation. Most importantly, their system is sustained through coordination and long-term support, rather than relying on early engagement alone. This highlights what is needed to move from initial rollout to more stable and scalable setup. So what does this mean for Canada? The focus now should be on supporting site beyond initial setup. This includes stable funding, workforce support, and integrating testing into routine care. Together, these gaps help set the foundation for broader impact and moving forwards. Overall, point-of-care testing is a practical way to improve access. It brings care closer, faster, and more directly to people, but its impact depends on how well we implement and sustain it. I will end with this. We already have the tools to eliminate hepatitis C. The real challenge is making sure they reach the people who need them most. I would like to thank my instructor, Dr. Mira Debar, and my supervisor, Dr. Brian Head, and her entire team for their support. Thank you, and I would be happy to take any question.